Welcome to Moorfields Eye Hospital. Our short animation tells you what you need to know about having a corneal transplant. The cornea is a clear layer on the front of your eye that helps focus light onto the retina so that you can see clearly. This structure needs to be clear, smooth, and regularly shaped. When the cornea is damaged, however, the person may experience blurry vision or pain. This is where a corneal transplant may be necessary to help restore the clarity and shape of the front lens. There are four main types of corneal transplant. The type of transplant you will be offered depends on the thickness of the corneal layer your eye needs to best improve your vision. Let's find out more about the different types of corneal transplants. PKP. This transplants the full thickness of the cornea from donor to patient. DMacc. This transplants the front 90% of the corneal cap onto the patient. Desect. This transplants the back surface of the cornea. DMacc. This is the latest form of transplantation and also replaces the back surface of the cornea. PKP, or penetrating keratoplasty, is considered when the full thickness of the cornea becomes cloudy due to disease or is scarred by injury. During this type of transplant, the central disease portion is removed and a new cornea from a donor is inserted in its place with fine stitches. These stitches are gradually removed over time as the cornea heals. DMacc, or deep anterior lamella keratoplasty, is usually given to patients where scarring or disease of the cornea is limited to the front part of the eye, like keratoconus, but the back part is healthy. With specialized techniques, we remove the front cap whilst preserving the back. This helps to reduce the risk of the new transplanted cornea from being rejected or not working. If the disease is located in the back part of the eye, then a Desect transplant is offered to the patient. The donor tissue is loaded onto a special device before being pulled into the eye. After this, a bubble is used to push the tissue against the back surface of your cornea. DMacc surgery is the finest and latest form of corneal transplantation. The back layer of your cornea is responsible for pumping water out of the eye and helps maintain clear vision. There are many reasons this layer may become damaged or stop working, from injury, previous complicated eye surgery, or conditions like Fuchs' corneal dystrophy. In DMacc, the donor layer is very thin and flexible like a soft contact lens. We carefully fold the donor graft and pull it into the eye. With special maneuvers, we unravel the scroll of cornea tissue so that it remains open. We then apply an air bubble so that this tissue sticks to the eye. This normally takes 3 to 5 days, which is why we ask you to lie flat as much as possible. We may use 1 or 2 stitches to secure the wounds, but often no stitches are required. Typically, your vision will gradually improve over the course of the next few weeks after your surgery. Sometimes, we may need to insert an extra air bubble to help stick the new cornea tissue down. We hope this animation has provided you with some useful animation and reassurance about your corneal transplant procedure. If you have any further questions, please do not hesitate to contact us.